My name is Raffaella Cartledge. I'm a journalist. I've had the pleasure of interviewing Camillo Ricordi quite a few times, and Professor Camillo Ricordi, and I'm also a therapist and a naturopath. And today we are going to talk about Healthspan with Professor Ricordi. I'll just make a quick introduction. So Professor Ricordi is Professor of Surgery and Chief of Division of Cellular Transplantation, is Professor of Medicine, of Biomedical Engineering, Microbiology and Immunology, is the Director of Cell Transplant Center and Director Emeritus of the Diabetes Research Institute at the University of Miami Miller School of Medicine. He's a fellow of the National Academy of Inventors and author of the bestseller, The Healthspan Code, in Italian, Il Codice della Longevità. So, well, before we dive into it, I just wanted to know where you are now, where we're talking from. I'm in France. I have a beautiful castle in the background. I'm not sure if you can see it. I'm very lucky to be
nice.
Lovely place. I'm doing a little retreat here. And so tell me where you are at the moment.
I'm in Miami, in my office at the Diabetes Research Institute, University of Miami, where I had the Cell Transplant Center and still involved in all the clinical trial to cure type 1 diabetes with stem cell-derived islets, islet transplant, and now aiming at inducing tolerance to avoid anti-rejection drugs. So I keep busy in this place.
Very busy, but before diving into our subject, I just wanted to know a little bit about your life. So you're between Miami. Do you travel to Italy a lot? How do you spend your busy life?
Yeah. Actually, yes, I'm going to the World Stem Cell Summit early June in North Carolina. It is a big event for our field. And then I'm actually have a big trip in Italy coming up because I have to be in Milan, and then I've been invited to speak at the Tau Book Festival in Taormina that some of you may know San Domenico from the series White Lotus on Netflix. And then I have to go to a board meeting in Palermo and come back to Rome and then to Milan before coming back to Miami. But it will be a busy summer of events. We have the World Congress of the European Society of Organ Transplantation in Athens in September, and then events in October too. So it'll be a little back and forth between Miami and Europe.
Okay, so your base is in Miami, obviously, because you teach there and you direct several departments at the University of Miami, but you travel to Italy often and to Europe. So fantastic. Okay, great. So I think it's the time has come to dive in our subject. You spent, so first of all, you're the author of a bestseller, The Healthspan Code.
But Prince Harry beat me with spare. So now I'm not,
you've been by
I
Prince
have a good rival as far as ranking.
I think I would rather read your book, and which I have had the pleasure to read. So it's, I have to say, I haven't read Spare, but definitely I recommend the Healthspan Code.
That was fun because in Italy, the Italian version, Il Codice della Longevità Sana, has been doing great. But then I asked Mondadori to allow me to publish the Healthspan Code that is on Amazon.com, and is really an updated version of the Italian book, but is I'm very happy that I did it because there is a lot of people that speak English that may enjoy it. There is also a version in Portuguese for Brazil and others in Portugal, and they're finalizing the Chinese edition, so that I don't think many of our
listeners will, yes, but that's fantastic. So tell us how, well, you spent all of your professional life looking, I mean, finding actually a cure for diabetes. So how did you, what convinced you to expand your work to Healthspan medicine, and also what are the links between diabetes and Healthspan?
Yeah, practically I spent my professional life, as you mentioned, to treat the most severe cases of type 1 diabetes with cell therapies, transplanting insulin-producing cells. And type 1 diabetes is an autoimmune disease, as you all know, that is the immune system doesn't recognize the insulin-producing cells as self and attack and destroy selectively the insulin-producing cells. So without insulin is incompatible with life. Before the discovery of insulin, children were treated with starvation diet and wouldn't live long. Then insulin has been a lifesaver, but still is not a cure. It's just putting a band-aid on a wound that never heals. So we start working on biologic replacement, on transplanting the insulin-producing cells. And type 1 diabetes is also the tip of the iceberg of the autoimmune pandemic, what I call one of the 3 pandemics that I describe in the book, because 20% of the population is affected by autoimmune diseases, and there are 100 different autoimmune diseases that affect pretty much 1 in 5. So this is very important. The second pandemic is the pandemic of viral diseases like COVID-19 that we've been deeply aware. But the worst pandemic is this chronic disease associated with unhealthy aging that affect 90% of the population in the United States above age 65, which is an age range that is destined to double in the next 2 decades. So we decided that after I started doing also cell therapy for COVID, saving a lot of patients intubated in the ICU with the most severe cases of COVID, with the same kind of stem cell therapy that we try to block autoimmune diseases at the onset. I said we should do something more than treating just patients with the most severe cases of these diseases. We should try to work on prevention and keeping people in mental and physical health, preventing that they become patients, which both autoimmune and viral and age-related diseases share this common background of risk factors that are in large also derive also from the diet that can imbalance your ability to fight hyperimmune and hyperinflammatory reactions. So that's why we started this initiative with the Healthspan Code book, but also with the website Fit for Healthspan, with Fit with the number 4, healthspan.org, to try to update what we learn and what is emerging in this field. Basically, to try to make people resistant to this pandemic and focus more on prevention, which is very difficult in the current health systems because the whole chain of profit of healthcare, which in the United States, healthcare is now $4.3 trillion a year, or 20% of the GDP of the country, is clearly becoming economically unsustainable if you don't start investing in prevention. But right now, prevention is not in the scope. There is no reimbursement like for keeping people in mental and physical health. So the whole chain of profit of the healthcare industry starts from patients, start from when someone go to the hospital or see a doctor, and then you start charging, being reimbursed, and the whole chain of profit starts. So it's a difficult proposition to invest in health and invest in prevention, but hopefully government and Minister of Health will understand very soon that this is a must, because for example, in the United States in the last 3 years, lifespan has been decreasing for the first time in history, and now they say that children born now may be the first generation that live less than the generation of their parents. And so we started working on healthspan more than lifespan, because who cares living until you're 120 in a wheelchair or in mental and physical pain. So we try to compress this phase of decline with the objective to live as long as possible in mental and physical health. And now you start seeing ranking of countries by healthspan for the first time. Before, all the ranking were based on lifespan, how good we are to prolong life. But this is often a lifespan that is sick, unhealthy, and with a very strong phase of decline of the last decades of the existence. So if you look at the Healthspan ranking, is quite interesting to see that while Japan, South Korea, Singapore may be the first places, and Italy is around the 10th place, United States are at the 69th place with a health span of 66 years, together with the Middle East countries like United Emirates and others, so that there is clearly room for improvement in this area.
So do you know where the United Kingdom places itself? Italy, you said, yeah.
United Kingdom, I'll find it. Let me see if I see the ranking table. I think it's in between Italy and United States, but
okay.
I have it. I saved the ranking. I'll tell you in a minute.
Yeah. So I just wanted, while you look for it, I'm going to talk a little bit about the book. So in the book, you discuss 3 levels of health span strategies. And
yeah.
so you go, into the health span actual practical guidance. So can you elaborate a little bit and tell us a little bit what you recommend?
Yeah, and United Kingdom, by the way, is 28th ranking with 70.1 year of healthy lifespan in this ranking table. So it's between Italy is on number 10, then you have Norway 15, Finland 19, Portugal, Australia and Germany 24th, and United Kingdom 28. So you're like doing twice as good as United States, that are at the 69th space, together with Arab Emirates, Lebanon, Bahrain, etc.
Wow. So tell us a little bit about the levels of health span strategies. Can you tell us what you out in the book in terms of?
Yeah. Practically, like, there are things that we can do to improve our healthy lifespan that are basically centered around 3 pillars. That are, one is healthy nutrition, that is common sense. The second one is physical activity and exercise. And the third one is protective molecules and substances that are becoming scarce, that we don't produce sufficiently, or that are deficient because of dietary and evolution of our lifestyle and diet. So, for example, while you have things that you can easily correct, like vitamin D levels and omega-3 levels, like in the decades we have observed a gradual shift to more omega-6 based food consumption, refined vegetable oils that are high in omega-6, more red meat and such, and less omega-3 like fish or nuts and things that can help balance this inflammatory profile that you generate. And vitamin D is also emerging as critically important. If you think that now there are papers in the last few months that indicate that if you have low vitamin D levels, you have not twice, not 4 times, but 14 times more probability to develop severe COVID or die from COVID. And at the same time, if you have low omega-3 levels, you have 4 times more risk to develop diabetes if you have antibody positive. So there are clearly common ground of risk factor that can be induced just by an unbalanced diet and the inability to fight triggering event of an autoimmune disease or a viral disease that could be like an enterovirus that triggers type 1 diabetes, or a SARS-CoV-2 that triggers a severe form of COVID. And how this work indicates that just increasing your level of vitamin D and your level of omega-3, you can already put yourself at the advantage to try to prevent the progression to severe form of both autoimmune and viral diseases. But this applies completely also to age-related chronic degenerative diseases that are, most of them are all based on inflammatory inflammatory background imposed by the wrong diet and lifestyle or lack of exercise. So it's the third pillar of the protective substances, besides the vitamin D and omega-3, we find that there is a progressive decrease in polyphenols and sirtuin activators with advancement of age. And sirtuin are the longevity molecules that keep our epigenome in health, preventing misreading of the genome, so that to avoid that your specialized tissues start de-differentiating. So with progressive age, you may have neurons that start looking like skin, or pancreatic islets, they differentiate and no longer produce insulin. So if you keep the epigenome in check and the sirtuin levels at good levels, then you can prevent the differentiation of specialized tissue. So that's why up to a certain age, exercise is key also for sirtuin activation. But after age 60, then the problem begins, and physical exercise is not sufficient. You still need physical exercise, is fantastic to keep muscle tone and prevent sarcopenia and other problems, but you need more and more with advancement of age to rely also, I don't like to call them supplements because they have a bad name for many, but I call them protective substances that can be rebalanced to keep your health and your physiologic ability to fight this progressive decline. That was the first level. There are also a very important paper that was published by the EPIC Norfolk study that was done on more than 20,000 subjects followed for a very long time, for many years. And they show that there are 4 health behaviors that already can help you increase your lifespan by 14 years. And each of them add 3.5 years. So if you have 2 of them, you can increase 7 years. If you have 4, 14 years. And these are very simple to apply because they're like vitamin C levels greater than 50 micromole milliliters. That means equivalent to consuming 4 to 6 servings of fruit and vegetables a day. But if you don't have access to this fresh fruit and vegetables, you can also take, like I do, 1 gram of vitamin C a day, possibly liposomal, that is better absorbed. And the second healthcare behavior is moderate physical exercise. You don't need to run a marathon, but just be physically active. Mm-hmm. And the third one is absence of smoking, no smoking, of course, we know that. And the fourth one that is more controversial nowadays is moderate consumption of alcohol, especially red wine, up to 1 to 14 units a week. That means at least 1 unit is a very small glass. It's not the Coca-Cola glass that you may find in American bar when they serve a serving of wine. So one alcohol unit is 10 milliliter or 8 grams of alcohol, which means that if you have something that is 10% alcohol is 100 milliliter, but if it's like 14% alcohol wine, the 14 volume wine, a serving is actually much less, is 71 milliliters. So that this is like some people have been questioning, any amount of alcohol is deleterious, and there are studies in South Korea indicating that may increase slightly the risk of some cancer. But if you look in South Korea and Asia in general, there can be also genetic variability in alcohol dehydrogenase, which is an inductive enzyme, which means that if you don't drink anything, you don't develop it. And if you drink a little moderately, you start developing these levels that can protect you and metabolize alcohol to avoid that it could be negative. So there are very long cultural traditions. I don't need to remind anyone, but a small good glass of wine is, I don't think, hurts anyone. And actually, this study has been clearly pointed out as one of the 4 health behaviors that help you stay healthy. So it's much more than just the ethanol content. It's like the level on your psychological well-being and community and socializing. And there are many benefits, including polyphenols and other factors that come also with a good glass of red wine. So I'm I'm not so Taliban in that direction to say you shouldn't drink alcohol at all. Just use it in moderation. Of course, if you cannot use it in moderation, that you find yourself, if you start with one glass, you cannot stop, then it's better to take polyphenols and sirtuin activators, because you can clearly, from a dose of polyphenol sirtuin activators that you can find in 2 pills, is equivalent to 12 bottles of red wine. So clearly, in that case, it would be better to get the pill instead of the 12 bottles that will induce other major health problems.
So after 60 polyphenols and sirtuin activators in forms of, I know the word, you don't like the word, in forms of supplements.
Yeah, and then there is the third level of the Healthspan code is actually more in the future, but you already see examples that are highly publicized. I reverse my biological age, because while chronological age inexorably continue to progress,
yeah,
biological age can be improved. Like you can have people that are 50 and they have a biological age of 34, or vice versa. You can have an unhealthy 34-year-old that have a biological age at 50, and then is a red flag to say we should start doing something to move it in the right direction. And luckily now with this testing for biological age, and it's possible to follow what are the interventions that you're doing or the modification in your nutrition, exercise, and health behaviors can help you go in the right direction or not. Well, before was all hypothetical. Up to arrive to the true reversal of aging that has been achieved so far in animal models, in mice, for example. Nature published the famous cover in 2020 for the first time that said, "Turning Back Time," big title, the first demonstration that mice that become blind because of age-related lesion of the optic nerves, suddenly they become blind with age or with a lesion that are induced to simulate aging, and then you implement this. In this case was a gene therapy by Dr. David Sinclair group in Boston that introduced genes that were initially introduced by Yamanaka to bring in vitro cells. You can now take any cells of the human body that has been aging in a petri dish, in an incubator, and add this gene and bring them back to the embryonic state, so just before birth. So they go all the way back to before someone is born, and then they can be redifferentiated into differentiated cells like insulin-producing cells, what we're doing now. So right now, for example, we just reported the first successful transplant of stem cell-derived islets, and the new data will be presented at the American Diabetes Association Congress at the end of June in San Diego, so I cannot give you the detail, but the first patient was already reported. I presented in Stockholm at the European Society Study of Diabetes, and it's amazing. You had stem cell-derived islets that were able to bring the patient completely off insulin with metabolic control 99.9 time in range and fantastic metabolic profile. So this shows that this is a mission possible that would be very important, because you can prevent the lack of organs from multi-organ donation with a potentially unlimited source of insulin-producing cells. And now the whole field is moving to perform these transplants without the need of anti-rejection drugs, like strategies from the Vertex new trial with macro devices that are immunoisolating, to the high tolerance company that has a fast ligand microjet that kills infiltrating lymphocytes and induces permanent tolerance to transplanted islets. But these are examples of how you can. So now you can bring the cells back in vitro. So now there is Sinclair Group and many others saying, what can we do to bring aging back in vivo in the real situation? So they devised a way to use 3 out of 4 of this Yamanaka factor. Yamanaka won the Nobel Prize to discover these inducible pluripotent stem cells that you can bring all cells back to embryonic state. And what it has been shown is that if you in vivo infuse only 3 of these 4 factors to avoid to go back to match and then have a risk of cancer or teratoma formation, and you put them with a so-called inducible conditional gene expression. That means that the gene that this gene therapy becomes effective only when you take a pill. In this case was doxycycline. And so then you could see someone that is like 50 wants to go back to 30, you start taking this gene therapy with this pill that activates the gene. Then when you're at an age that you like, you stop going back and you start aging again. And in theory, this could be a process that can be repeated multiple times. You can go 30, 40, or 20, 30 as you wish, or 70, 50, and return in physical and mental health. So this is why this demonstration that can be done also in vivo has triggered a battle and a race without borders, if you wish, between all the big groups from Jeff Bezos started Altos Lab with a couple of $1 billion. Saudi Arabia started the Evolution Foundation with $1 billion a year funding for Healthspan medicine, and many initiatives are in this direction. And it's not just for people that are very wealthy and want to live forever, but it's also for healthcare expenditure. If you think that 1 year added to healthy lifespan can save $38 trillion to the global economy, and we could do much better things with those 38 trillion or 380 trillion if you improve 10 years the lifespan, bringing like the lifespan of Americans to the lifespan of Japanese, for example. And from global warming to hunger and all the big challenges facing our century. So instead of spending for preventable degenerative disease that are linked to unhealthy aging, we could do much better with this funding. So it's a very interesting, so my objective and the reason I wrote this book is to help everyone, one person at a time, until we develop strategy for everyone. But there is something that can be done starting now, acting on our own lifestyle and nutritional and physical activity and health behaviors.
And Professor Ricordi, can we maximize human health span without improving the span of our planet Earth as a whole?
Yeah, that is a very good. It's a very good question. In fact, two of the comment appreciation that I have in the Healthspan book come from Nobel Prize Riccardo Valentini, that is European Academy of Science and Nobel Peace Prize recipient in 2007. And he says, as indicated by Ricordi in the Healthspan Code, I've discovered a name, no, excuse me, this is another one. The Healthspan Code take us on an exciting journey into the most fascinating mystery of science, of the secret of longevity. There is no doubt that health of man and the planet are intimately linked. Ricordi explained this to us with scientific rigor when he warns us about how our eating behavior can be ruthless triggers for our life expectancy and at the same time impact on nature and the environment that surrounds us. Making ourselves and the planet healthy is the next challenge of science, and this book admirably lays the foundation. And also Barbara Buchner, who is the Global Managing Director of the Climate Policy Initiative, says how we produce and consume food affect both our health, our environment, our economy, and our society. And humanity's potential for healthspan goes hand in hand with the health of the planet. As an acknowledgement elaborated so eloquently in this book, which has been and continues to be fundamental in moving the debate out of the silos, and which represented years ago a wake-up call for her to focus on solutions that can work both for the planet and for the well-being of people. So, of course, there is no health span improvement if the planet collapses. So that is of course, but it's something that is maybe is less apparent, that we are what we eat, but also what the animal and their products that we consume eat. So that the food chain of unhealthy diet and inflammatory diet and the high glycemic index, high processed foods, and this whole environment that increase the level of subclinical inflammation that is at the base of all these chronic degenerative diseases that accelerate aging and unhealthy lifespan is a chain. Like if you take a cow that is a mass fed with the wrong feeds, they produce milk that are less healthy than a cow that is grass-fed or fed of a healthy diet. And there are, you find it, meat should be reduced for sure. I'm not like saying eliminate completely, and I respect vegan and vegetarian, but even if you want to eat meat once, it used to be like you sacrifice an animal if you have a big celebration, a wedding, a newborn, or something to celebrate, and then gradually became a status symbol. You know, say, wait a minute, we're not eating fillet or you know, how do you call it? We're not eating the top selection of meat, or we're getting poor, and it became a status symbol. And then we discovered that maybe unhealthy and increase the risk of a lot of disease conditions, besides being bad for the planet, because 1 kilogram of red meat may require 15,000 liters of water. And then you rethink, like maybe you can decrease this consumption and also be careful of what kind of meat you consume, because like we have, well, Angus in United States may have 25% fat, like the Chianina in Italy or Piemontese may have 1 to 1.5% fat, and I'm not sure which varieties you have in UK, but probably you will find similar differences also there. So we should keep an eye also, you want to red meat, which red meat you consume occasionally. And the same for eggs, like, you know, you have chickens that produce eggs that have different levels of nutrients, and they can be more or less pro-inflammatory depending what is the feed of the chicken that are raised. So that is all a chain. Also, the way to arrive to fish, like if we would want to assume the suggested recommended dose of omega-3, say 4 to 5 grams of omega-3 a day, would require you to eat 6 kilograms of lobster or 2 kilograms of tuna. But then you have mercury, heavy metals, and other contaminants in the water that can affect the quality of the fish that you eat. So then the benefit of increasing your omega-3 through fish must be balanced with the quality of the fish that you can afford, and that's why we discuss also in the book what kind of fish and varieties we should privilege. But it's really one of the examples that we make, and I make a table of what is the amount of protective substances that you can just get through healthy nutrition, and it's very difficult because, you know, resveratrol and polyphenols, you would have to drink 12 liters of wine or consume 30-60 kilograms of grapes, and you have omega-3 with the 6 kilograms of lobster or 2 kilograms of tuna a day, besides the calories that are associated, because another reason and criteria for Healthspan is reducing the serving size and intermittent fasting, or trying to make breaks in the time that you eat during the day and try to put your liver at rest and metabolism. So it's all it's complicated in a way, but we can all start learning. The best way to start affecting negative trends is to become aware and start learning more as we go forward.
Exactly, and you've anticipated a question. So the issue of the earth has to do also with the depletion of minerals from the soil. So we have an audience of nutritionists here, and some say that we don't need supplements if you eat well, but many of us, because of the reasons that you've just enunciated, we believe that, you know, unfortunately, we need to supplement exactly for the reasons that you just talked about.
Yeah, for example, omega-3 are important because depend where you live. I don't know, if you have uncontaminated water and fish, you may be fine. But in Florida, for example, you can eat grouper once every other week or once a month. Some fish you cannot touch if you're pregnant. So it's very difficult to maintain a healthy nutrition in the absence of the health of the planet and the animals that live in the planets, like including humans. So that if someone can do it through nutrition and healthy nutrition, good luck. I mean, I'm happy for them. But in my experience, it's impossible to get sufficient amount of protective substances, especially going forward in age, and especially maintaining also calorie control and portion size control, and not to say intermittent fasting or caloric restriction that are not something that I follow regularly. But you know, it's very tough to do it just based on nutrition and exercise, even if they are two critical pillars. I remember a slide that was quite emblematic, that has they put on a chair a bottle of whiskey, a cake with whipped cream, and then a pack of cigarettes, and then an hamburger with French fries. And the question was, which of these is the worst for your health span? And it's the chair. So it's like sedentary lifestyle is one of the worst factors promoting accelerated aging and unhealthy lifespan. So it's all goes together. So you cannot get a pill and say you're fine because you take your omega-3 supplement. And the VITAL study clearly showed that, because it was started from a funny assumption that they said Japanese people in Okinawa, like, they eat fish every day and they have 1/4 of the heart disease that we have in the United States. So let's do a study and let's give the equivalent of 1 serving of fish, that was 1 gram of omega-3, actually 0.83 gram of omega-3, to Americans, and see if the cardiovascular risk decreased fourfold. But the problem is that those Americans eat the pill and then go out to eat hamburger, French fries, and 5 pizzas. That doesn't help. It would be like saying, I test if Slim Fast can help in weight loss or a liquid diet. I give everyone a can of Slim Fast, then you go out and eat 5 pizza, you didn't lose any weight, so you say Slim Fast doesn't help you lose weight. So you have to be careful of the target range when you do any supplementation. If you give omega-3, you should look at the inflammation index, the ratio from arachidonic acid, EPA, for example, how that improved toward the target range that we have set at 1.5 to 3.0. If you have vitamin D, you need to increase your level to 40 to 80 nanogram milliliters, but without going above 100, because you could have calcium metabolism problem or renal problem, unless you're under supervision. There are some protocols that give you tons of vitamin D, but they're not done under medical supervision. So everything is not just a supplement, but is what is the target range that you have to achieve, and what you do around that supplement. So the combination, why we say 3 pillars, is because you cannot just exercise and eat like if there is no tomorrow. You cannot just take a pill and eat wrongly and stay in sedentary lifestyle. It has a combination strategy, an ecosystem of health span that you have to create around each individual. And education is central, and you have to start very early, because it's been shown that even what you do, you don't have to wait when you're 60 to implement health span strategy. You should start when you're a child, parent, and even when mothers are pregnant. So it's a whole circle of life of health span behavior that has to be introduced as soon as possible, I believe.
So we've assessed that biological age can be improved and reversed. So what are the best markers for healthy aging? We talked about inflammation markers.
Yeah. So we have, I think the easiest one, if someone doesn't have the money to do very advanced health span markers and biological age markers. Now there are several platforms like True Diagnostic, True Age, or Insight Tracker, or Tally Health, and others. But the easiest association with healthy aging is insulin sensitivity. So if you see how is insulin resistance, that is a very under-considered factor, because we have hundreds of millions of people that don't have diabetes diagnosed, but walk around with insulin resistance, which is a strong, maybe the strongest factor associated with accelerated aging. And you can check if anyone that if you do a health check or a blood sample once a year, or whenever your next blood drawing is, you should ask to add not only 25 OH vitamin D to check your level of vitamin D and make sure that it's between 40 and 80, not just the inflammation index, that is the ratio between arachidonic acid and EPA, that tell you if you have a subclinical silent inflammation, but also like you can do fasting glucose, fasting insulin, the HOMA, calculate the HOMA insulin resistant index. It is very simple based on these two factors, and then you can look at the free fatty acid or the ratio between triglycerides and HDL cholesterol. So you can have in a simple blood sample, without spending the hundreds of dollars for a biologic aging assessment, you can get an idea if you're going the wrong path. But of course, if you can afford it, because right now, unfortunately, these biologic aging markers are not reimbursed, then it's much more in-depth analysis of all the DNA methylation, epigenetic changes, and predictive factors that can tell you with more precision what is your biological age compared to your chronological age. So it's a rapidly evolving field, and I'm sure we'll learn much more in the months and years to come.
So what should we expect in the months and years to come? Another sequel to the Healthspan code?
Yeah, I've been asked, well, Mondadori just asked me to say this one is going into this series, Oscar bestsellers, the Healthspan code, the Italian version, Il Codice della Longevità Sana, and they asked for a sequel that is more practical on tips and what should we really do besides setting the basis for all the Healthspan behavior and risk factors. And so I may be, not now, but in 24, I may work in my free times, night and weekend, on something, on something more. But in the meantime, I try to update occasionally the website Fit for Healthspan. I have also a Fit for Healthspan, Fit for Pandemic Instagram, and my Instagram page, Camillo Ricordi, MD Official, that is, I try to keep up and post through between Facebook, LinkedIn, Instagram, keep people updated on my followers.
So follow Camillo Ricordi Official and Fit for Healthspan. Yeah, and buy the book. Can you show us the book again?
The book is
on Amazon.
I'm not in the job of selling books, so the funny things that they ask me is that every event, and you've been at one of them, I bring the book and give it for free to all the participants.
I was at one of these events where you gave it up.
I'm trying to help people. I'm not trying to become a bestseller book, selling books to autograph. I'm just, and if someone doesn't have the money to buy the book, I can give the PDF if they promise not to tell any of the publishers, otherwise I get in trouble. But or at least I can give you chapter 9 that has a summary of all the concepts. But hopefully everybody can afford, instead of getting a bottle of whiskey, get a copy of the book and may save your life.
Fantastic. Professor Ricordi, thank you so much for your time. It's been very interesting as usual. And we will be in touch very soon as you publish your next book.
Great, thank you. Always a pleasure to be with you in any event.
Thank you very much, Professor Ricordi.
Right, thank you, and thank to the audience. Bye.
Bye.